So this is AA4FLJ at the microphone in Hawthorne, Florida. And this is the Medical Amateur Radio Council Grand Rounds Day or Net. We have roundtable discussions on subjects that are usually medically related. However, we do talk about radio and other technical discussions as well. Today, we're discussing medical therapy using psychedelics, the clinical evidence, mechanisms, and the future directions. And we're looking at it from the perspective as for medical professionals, but we often discuss things that are more targeted to the general population of amateur radio operators. And even so, we will have the discussion in the framework of being accessible to all amateurs and everyone in the public venue that might be looking at our video that we create on Zoom later. So the roundtable discussions by our members, there's many on hand here. In the comments that are made and the discussion held are opinions of the individuals who are speaking. It's not the organization itself. Of course, this is not medical advice or treatment suggestions. I think you'll find some of the current events and the tie-ins to those current events to be interesting. And certainly we encourage you to do more research. Also today with our Zoom simulcast, and I'll mean the moderator, Jay Garlett's AA4FL, I'm a dentist. I don't really have any personal experience with psychedelic drugs. I missed that during the 1970s. I was studying too hard to get into dental school. I growing up in Miami, that's a success story, I should say. And it's been in the news quite a bit lately. There's a lot going on right now with psychedelics. And whether you're on CNN or Fox or other news venues, you've seen articles about it. And in those articles, they talk about numerous aspects, trying to get an idea here on the dates and times. We're looking at April 18th, 2026 here, the first article that I found, or one of the first ones I found, about the executive order from President Trump urging more research into psychedelics. Everybody copying well here on 20 meters, everything good on Zoom? Just give me a thumbs up on the Zoom side, please. Okay. Great, on 20 meters, do we have any other check-ins? Make your call. Okay, no additional check-ins on 20 meters. So signing the executive order was aimed at encouraging expanding research into psychedelic drugs, part of a broader push to explore emerging mental health treatments. Because in many cases, according to this article, these experimental treatments have shown life-changing potential for those suffering from severe mental illness and depression, including our cherished veterans, Trump said. This is quoting President Trump during the signing event. And he also announced that the federal government's making a $50 million investment for further research into the psychedelic drug ibogaine. Now, I'm not sure if I'm pronouncing that correctly. And this is, again, from the CNN side. But in addition, similar articles have appeared on Fox News. And there's one that was published on April 20th, 2026 on their website. It was Joe Rogan reveals text to Trump that helped expedite the federal review of psychedelics. So now this is something that's being discussed beyond. The president has his advisors, and he found it to be extremely inviting, interesting to the veterans, particularly, and made it a priority. So he signed that sweeping executive order to fast track the research. And you can read the quotes, whether you read it on CNN or you read it on Fox. The quotes that are used obviously are going to be cherry picked with a certain perspective. So check out the subject matter on other news venues as well. Going back to CNN, they did one on ibogaine. Now, Stuart? Are you familiar with the pronunciation? Is that the correct pronunciation?
Sorry, I don't.
I'm sorry, go ahead.
Don't know.
Okay. Does anyone that's here on our roundtable discussion know if we're pronouncing this correctly? How about that for something that's so new that none of us can even confirm its pronunciation? But it's a drawing a lot of interest from the Trump administration, being that it's one of the newer psychedelics that they're looking into. So hopefully we'll see a little information in the background. And going back here to Fox News again, it'd be psychedelic therapy may be coming to your doctor's office as questions were also. They're quoting studies saying a single dose of powerful psychedelic cuts depression symptoms in a clinical study, and they expound more upon the discussion that we're talking about being a focus on the administration to look into the research and get it to be treatments if warranted. And the FDA, this is a CNN article, that they're looking at priority vouchers and moving to fast track psilocybin, methadone for mental health. And you can read these articles if you go to CNN.com and go to FoxNews.com and look for psychedelic drugs. Don't look for the drugs. Just search for the information on psychedelic drugs. See what they've said, and go to the internet in general. And speaking of that, with AI, so what I did for today, and this discussion is just as much about the AI and the AI generated content. The PowerPoint uses Copilot as its menu to create. So I put in the psychedelic drugs and medical therapy, and Copilot gave me a lot of choices to build presentations depending upon if it was medical professionals, if it was businesses, etc. There were like 3 or 4 choices. I picked medical therapy, medical physicians, and it built a 20-slide presentation. And I'm going to read the quote from Copilot. Let's do what Copilot did. It said, Copilot quoted, "I built a 20-slide presentation on psychedelic-assisted therapy tailored for medical professionals, grounded in the latest clinical evidence through April 2026. Covers the historical arc from Hoffman's 1943 discovery through the recent Compass Pathways Phase 3 results and the 2026 executive order with deep dives into psilocybin, MDMA, ketamine, DMT trial data, the mechanisms of action and the default mode network modulation, the safety profiles, the regulatory pathways, state legislation, the clinical implication protocols, and the ethical considerations." That's a lot. That's a lot that it took about 20 minutes to generate the slides. And the key data includes Compass, COMP360s, statistically significant MADRS reduction. It's the scale, depression rating scale that they use in treatment-resistant depression, esketamine monotherapy approval, and the emerging DMT phase 2 evidence from Imperial College. So, again, I had to go and look up some of these terms, DMT being a medication, potential medication that's smoked or brewed. And you'd have to go in, and I'm sure every one of these would be a subject unto itself. And from there, Copilot mentioned you could add speaker notes with talking points for each slide. You can include additional data charts for specific trial endpoints and adjust the depth of any particular section. And if there's one more slide, we'll talk about the AI from Copilot. But I know Stuart's with us, WA9ZPL, and he's used other search engines, and so is N4JEL. They've mentioned in the past. Stuart, if you would take a moment, I know you've used some that are a little more medically orientated, and could talk maybe about the accuracy that you found in doing some of your past queries on the different search engines. Turning the mic over to A9ZPL. This is Whiskey Bravo 5 Delta.
The media sometimes wants to have a headline that's clickbait to get more viewing. And I think right at the beginning, we have to make certain points. Almost all of the drugs that are mentioned in today's slide are not approved by the United States Food and Drug Administration for any purpose. And when you're dealing with the, of course, drug companies,
We're losing your audio a little bit. You're fine for a while.
I don't know what the problem is with the audio. Um, I did switch to a different device. Um, I'm a little closer to the mic. Does that help?
USL, please proceed.
Oh, I was mentioning that we're talking about drugs that aren't FDA approved, and we have to be aware of people who may have a conflict of interest. There's a lot of money at stake when people are seeking FDA approval, and there are a lot of penalties.
Dropping again, Stuart, dropping again.
Had to do better.
Right now.
Other point that gets confusing is when you see a headline that the federal government has authorized a clinical trial.
Okay, we're dropping out here, Stuart. So thank you. I know Stuart in the past has mentioned some of our other subjects we've talked about, doing research using some of the medical search engines specifically intended for doctors and having the accuracy of being, less than ideal. You still have to go through and today keep this in mind as we talk about the subject material that and we'll talk about it as a group in a roundtable discussion and make sure to let us know if you find something that you find that you want to comment on. And for JEL, you're also here with us, and I know in the past that you've done quite a bit of looking into the accuracy of search engines and trying a few. Would you like to take the mic and tell us your experiences with researching on search engines? Go ahead. Okay, and for JEL, I'm not sure if we're still here. Um, being at the long Zoom session. So this is Whiskey Bravo 5 Delta, J at the mic, AA4FL. And we appreciate everyone being here with us today. And it gets a little confusing when 20 meters is so poor. And a lot of us do multitask, so they may be on for a little while and then step away. My co-pilot also noted that they populated the speaker notes across all 20 slides I've asked for, detailing talking points tailored for medical professional audience, covering all the different nuances. And from the opening framing through the trial evidence, as Stuart mentioned, these are not FDA approved drugs. We're talking about them today in terms of what the Trump administration wanted to do for research and the reasoning why the potential for the research to come up with medical therapy might yield results. And a few of the things that it could do, in addition, it could co-pilot being a particular AI engine. It could adjust the tone or depth for a different audience. It can add final outlook, future outlook slides, notes, condense the notes into shorter bullet points for quick references. So there's many different ways to look and use AI, but realize as we have this discussion that we're the source it's generated from. This is much of this discussion AI is on the subject materials. So the executive overview is we're expecting by 2029 a market of $8 billion. As Stuart mentioned, there's a lot of money involved, and that can affect research as well. And there's 130 plus active clinical trials globally, because we're not the only country that does clinical trials. But the FDA has designated 3 breakthrough designations. So those are the ones we're going to be extracting, I suppose. And there's a 70% response rates in the treatment of resistant depression trials. Psychedelic assisted therapy represents one of the most significant paradigm shifts in psychiatric medicine in decades, or potentially if it would occur. So multiple compounds now in advanced clinical trials. So as in terms of psychiatry, we do have a psychiatrist with us here today, N5RTF, and Chip How long do you think, I know it's just going into research, say it is favorable uh, to have it be used by all psychiatrists? Seem like it would take a long time. How would you see this unfolding in the psychiatric physicians community if these medications were approved? Do you think we would end up with people that claim to be specialists in the field? We turn the mic over at 10.5 RTO.
Yeah, this is N5RTF. Thank you, Jay. I don't think you'll ever have all psychiatrists using anything. There's definitely going to be people that gravitate to this, just as there were back in the 60s. You had usually psychologists who were enamored of these drugs and thought they could cure everything, back when they were still legal, and they tried them for everything, and results were pretty mixed, but generally disappointing if you really look back and see what happened. The one message that I would have people keep in mind throughout this presentation and afterwards is these drugs do not put anything into your mind that wasn't there to begin with. They're not a magic glass into a different universe. They're not going to have God dial you up and give you the secrets of the universe. About all they're going to do is what we would call shake the box. When people get stuck, people in certain clinical conditions, they give the appearance like in severe depression, people tend to think in loops. It's a positive feedback system where the more they think about something, the more depressed they get, and they think about their depression, and that makes them more depressed, and they're just stuck in loops. Like for an electrical analogy, think of an amplifier that's oscillating. What would you do with it? Well, you could poke around in it, or you could just turn it off and back on. You could move it around, adjust the microphones and speakers and things like that until the oscillations stop. This is the same thing. You can use drugs, you can use physical interventions like ECT, and you can use psychotherapy. There's three different ways to program the brain. And this is probably going to be one of the ways to do it, but it's not an end all and be all. And it's really you're just shaking the box and hoping you end up in a better place. Any specific questions, Jay? N5RTF.
I'm sure we'll have some follow-up ones, Chip. Thank you for getting this roundtable discussion started.
Okay.
5RTF, AA4F, Help the Mic for ID, Medical Amateur Radio Council, grand rounds on the internet. We meet weekly on this frequency. This is AA4F, Help the Mic, operating out of Hawthorne, Florida. And our net is one of calling on our check-ins here to have roundtable discussions. Today's subject is about psychedelic drugs. And as we heard Chip mention, may one day turn out to be part of a treatment armamentarium, but it in itself is not isolated in assistance. And perhaps we'll see history, of course, will be 2020 at the time, but we have a long way to go before we can reflect upon the pathway that it takes. But the government has realized there's enough hints of efficiency or possible applications to warrant the research. And here in the United States, that's happening now. President Trump recently announced that as we discussed. Looking at the historical timeline of the psychedelic research, we're talking about 1943, Albert Hofmann discovering LSD's psychoactive properties. We're looking at LSD, which of course during the 1960s was brought into culture. I'm not sure if Lucy in the Sky with Diamonds by the Beatles is really referring to that. They claim not. But psychedelic drugs and mind-altering drugs in the 1960s, you can think about it in popular culture, and you can think about it even before in traditional We had Alice in Wonderland, and part of that story suggests that there were psychedelic drugs used. We also had that made into a song by Jefferson Airplane in the 1960s, Go Ask Alice. So the first clinical studies of psilocybin or the magic mushrooms, 1958, the drug within magic mushrooms. Controlled Substance Act, after all this 1960s activity, gave everything a Schedule 1 classification. So that put the kibosh on any scientific research or use. But by the 1990s, research renaissance began at leading universities, and more recently, in 2018, the FDA granted breakthrough therapy to psilocybin. In 2020, Oregon legalized psilocybin-assisted therapy, according to the research provided by Copilot. And in 2024, the FDA reviews MDMA for PTSD, issued a complete response letter for post-traumatic stress disorder. MDMA being the synthetic drug, ecstasy, also known as Molly. So it's taking us a little bit more into the 1990s psychedelics, I suppose. And Compass phase 3 positive results resulted in the executive order being signed by President Trump just here in April of 2026. Any comments from the group on Zoom? I'll pause one and just raise your hand here if you physically raise your hand, you'd like to make a comment at this point. Is there anyone on 20 meters here that would like to check in at this point and or make a comment, make a call to Whiskey Bravo 5 Delta? Nothing on 20 meters at this time. The key psychedelic substances in clinical use here for trials, that is, clinical trials. Psilocybin, tryptamine, the regulatory status is phase 3 of the FDA, so we're in trials. And the primary targets are treatment-resistant depression, TRD, major depressive disorders, MDD, and addiction. Well, that's the thought as to why more research should be done on each of those particular targets. And the MDTA, the ecstasy, phenylalanine class, phase 3 trials already for PTSD, post-traumatic stress disorder. And of course, when we talk about PTSD, it's common for a lot of reasons, but with the military veterans suffering, many of them so badly from PTSD, there's certainly good reason to do the research if we could bring some relief to them. Ketamine, which is an FDA-approved drug, but not for that particular reason, but looking at it for treatment-resistant depression. The esketamine version, DMT, another medication here, which is a long scientific name, something that's smoked or brewed. You can look that up. It's a tryptamine type drug and reached phase 2A regulatory status for treatment-resistant depression and also major depressive disorder. And LSD, ergoline, in phase 2 for anxiety and addiction. So Chip, N5-RTF, I know you're not someone that particularly partook in these drugs, but in your clinical psychiatric practice, did you happen to, maybe LSD was at a time that predated your psychiatric practice. I know you were also a general physician first, but did you ever have a patient talk about using LSD out of a health concern? Let me turn the mic back over to N5-RTF. Chip, go ahead.
Not patients so much, but if you remember, it was legal back in the late 60s and up to about 1970. So I knew people that took it, even watched some people take it back when it was legal to do so. And, it's an interesting experience. The danger is your judgment is greatly impaired and people will get the idea that they can fly and just walk out of a window. So you need a guide, someone to be with the person throughout the entire experience, which can last up to 8-10 hours for some people. So it's that's one of the complications in using LSD is it is very labor intensive, and having someone wholly committed to monitoring the patient throughout the entire experience. That limits its clinical applicability. DMT is much shorter acting and may be able to step in and actually provide some short-term therapy options.
Thank you. That was N5RTF. Chip, New Orleans. Chip is a retired psychiatrist. We appreciate and value your input there, Chip. And I guess we did find out from the report that 1970 was the date it became a Schedule 1. All these became a Schedule 1 drugs. So that was the end of its reputable use at the time. And the different clinical trials, I'm sure, are looking at all the particular details you just mentioned, how the application should be done, under what environments, what dosages, what risk factors, et cetera. And we look forward to those trials being completed and some potential medications being offered if it's substantiated. But psilocybin being a naturally occurring compound in 200 species of mushrooms, they grow wild across nearly every inhabited continent, particularly in tropical and subtropical climates. The most well-known species containing psilocybin is widely used in both traditional and modern contexts for its hallucinogenic properties, and they can be consumed fresh or dried, often used in rituals for spiritual exploration and healing, according to Wikipedia. So for all that's worth. What's interesting in this particular co-pilot, I asked for references, and it did not provide a list of links. Usually when I do a discussion, we go ahead and put in the URLs or the internet sources and put that in our slides, so you just click on it and read. So you can do your own research in any of these, of course. Being that we're not necessarily professionals, health professionals or the public or amateur radio operators that are experts in that field, one has to be able to consume the information and look at the way that it's written and make sure that you can understand it, because you don't want to reach wrong conclusions. That could be dangerous, and you certainly want to wait for the FDA approval. But the mechanisms of actions is a particular receptor agonism, serotonin 5-HT2A receptor, the primary target for all the, at least for those medications, and high density expression of the prefrontal cortex layer 5 pyramidal neurons. There is a target and a reason that these become effective. It also affects downstream signaling, a pathway that increases glutamine release and cortical excitability. They're talking about a triggering a release in that particular pathway. The clinical terms, you can look at them on the slides on healthcarehands.org and look at them in more detail. Realize that as we have these discussions, and we're here in 20 meters on amateur radio, and we're also talking to the general public on our YouTube videos, you can research any of these on your own. You find a word or a topic, because any one of these would be a topic unto itself. This is just an overview and in a group discussion, a roundtable discussion. Again, these are not health recommendations, merely just information on the subject and what seems to be happening in the public venue right now. But cortical plasticity, rapid induction here in dendritic spine growth, effects persisting for weeks after a single dose. That remains to be seen. That's what AI said. But if we can get more cortical plasticity, if we can reset those loops that Chip was talking about, where individuals are stuck thinking the same thought over and over and release it, and you can see where that potentially could be of assistance. Entropic brain hypothesis, where increased neural entropy and cross-network connectivity may enable therapeutic reset of rigid cognitive patterns. Those loops that Chip was just talking about. Chip, does that sound, does that seem to match with what you were trying to say? And paraphrase that N5-RTF. Go ahead.
Yeah, yeah. I again, I think the best way to visualize it is just that people get trapped in loops, non-productive loops in their thinking and in the way that they process information. And these are sort of like kicking something that's wobbling, and hoping that it's going to straighten up. Um, Sometimes it works, sometimes it doesn't. Sometimes you have to do it more than once. It's not very scientific, but again, it does work. People have been doing all kinds of things empirically since medicine began. Not without a good scientific explanation, but you learn that things work and you use them. Um, it's interesting that most of these drugs work on the serotonin system, um, which is really it's interesting that they have so many different effects working on a single receptor. Could be the impurities in the drug, the differences affecting other receptors as well. It's a very complex system. And it's going to take, as you said, years to separate all this stuff out. And we may have something better before then. This may just be a stopgap until we really find out what the real problems are. N5-RTF.
Thank you. It's N5-RTF, AA4FL at the mic here for ID, the Grand Rounds in the Air, the Medical Amateur Radio Council, Whiskey Bravo 5 Delta, open to all amateurs in 20 meters. We're solving a Zoom simulcast today. Do we have anybody else on 20 meters that would like to check in and make your call at this time? Whiskey Bravo 5 Delta. Okay, no further check-ins at this time. Any comments from those on 20 meters or questions? Make your call. Okay, Keith, N3IM, if you're still here with us, Keith, I believe you went to medical school during some of those years. Was it before? Maybe not. Maybe not before 1970. But you went to medical school in Mexico also. So, uh, does this ring of any memories of what maybe the local population or what things were being used at that time? Keith, if you're still with us, N3IM. AA4FL, the mic, Whiskey Bravo 5 Delta. Go ahead, Keith.
Yeah, I grew up in, well, I graduated in the mid 60s, so I kind of grew up in the flower child era. Saw a lot of people using various drugs, including marijuana and LSD, but never tried it myself. As far as Mexico's concerned, they are very much in the outer areas of Mexico and the poorer areas where the small little communities are still using hallucinogens, uh, particularly the cactus type hallucinogens and uh, psilocybin and things like that. So, but other than that, I didn't see much of that in terms of me using it, but I did see fellow students when I was in college using it. So I saw how they were affected. That's everything.
Would you tell us a little bit more than what you observed? Over.
Well, for instance, one of the roommates in the dorm I was in come in one night and he thought he had turned into a bee and was buzzing all over the dorm and making quite a fool of himself. interestingly enough, he did that more than once, but he went on and actually quit college, went to southern New Mexico, and became the biggest hog farmer in the state.
Thank you, Keith. N3, I am Whiskey Bravo Delta. Now, Andy, WJB, I know you were in internal medicine, I believe, and, um, later, much later than after the Controlled Substance Act was. But did you happen to run into anybody that was using hallucinogens or psychedelics? Over.
The only time that I was around that use of that, and that was semi-legitimate, was using marijuana-based drugs for appetite stimulation in people with AIDS before we had the really good drugs for AIDS, and occasionally for people who were cachected from a metastatic tumor, and those were about the only time I was around. I don't know, it was technically, maybe legal. As far as seeing patients with it, no, did not see patients until 1976. And that would be midway through my medical school career when I started actually seeing people with any advanced numbers. So I did see occasional people in emergency room rotations who had been on LSD, and their behavior was often quite agitated when that came up. And again, I was there as a student, not as the main physician. So that's not the only experience I've had. I mean, I did have the experience living in the dorm, seeing people who were using marijuana and other drugs, and some bizarre behaviors similar to what was already described. I saw some of those as well. One time, a guy who um, decided that he was going to, the peppermint schnapps was going to cure him. So he smoked weed, and then he went out in the snow and drank peppermint schnapps and tried to sleep in the snowbank without really much protective clothing. So fortunately, other people in the dorm rescued the guy and drug him back in. But that was the kind of bizarre stuff you could see with these drugs. So back to you, Jay. This WJB.
Thank you, Andy. And as a dentist, I can say in the 1990s that ecstasy was a concern because of advanced dental decay for whatever reason, whether it was just poor hygiene or dry mouth effects. But people that were using ecstasy excessively, and raves were real big back then in the 1990s, the early 2000s. I imagine they still are. I don't know if it's the drug of choice anymore, but it certainly got a lot of press back then. And it did get some attention in the literature concerns as you're seeing patients and you're trying to, rule out whatever this advanced cause of dental decay was. So that there are other side effects. Of course, that wasn't being used for therapeutic reasons. That was being used strictly to enhance, I guess, the environment at the vet scene. For ID purposes, Whiskey Bravo 5 Delta, Grand Rounds on the Internet, talking about psychedelic medications today. The Grand Rounds on the Internet meets every week at this time on 20 meters and has so for many years. We're talking about DMMM, which is the default mode here that we're talking about breaking this disruption of repetitive thought via decreased default mode network hyperactivity. So there is chip modulation, that's like an amplifier that might be oscillating. Any other oscillator, once you get in this loop, you got to get out of the loop. And this is one reason we're talking about the psychedelics, reducing the connectivity, temporarily dissolving the rigid self-referential processing implicated in depression, anxiety, and addiction. And the increased connectivity, cross-network communication enables novel perspectives and cognitive flexibility, and also the neuroplastic window. So if you have a 2 to 4 week period of enhanced synaptic plasticity enabling therapeutic integration, that gives the opportunity to take more traditional approaches and hopefully broken the ability, you've created the ability, you restored the ability for more traditional therapies that they may have been reluctant to or impossible to break through at the period that they didn't have that plasticity. In the clinical evidence, they did go out and search it, the AI co-pilot, talking about phase 2 and phase 3 trial results. And psilocybin in February 2026, the first phase 3 trial for treatment-resistant depression did show a reduction versus a placebo, and by week 6, the primary endpoint was statistically significant, 29.1% reduction versus 10.9 for placebo. So I assume that means that they were trying some of the other approaches. We don't know the study and how it was designed, but if the only difference was the medication versus the other, the placebo, you would be able to obviously look at the reduction. So it was a randomized, double-blind, placebo-controlled study, and there was a dose with psychological. Okay, it says with psychological support versus a niacin placebo, and it gave the endpoint at week 6. They also mentioned that there was significant improvement observed as early as day 2 post-treatment, sustained response. So a FDA priority review voucher was issued in April 26, 2026 based upon that. Do we have anybody here on Zoom that would like to comment?
Jay.
Here we have Dave, KN2M, go ahead.
Thanks, Jay. I've got to leave soon here. I've got a hospital issue. I'm not sure if you mentioned or I missed it, but I use ketamine from time to time in my practice. It was originally a drug used for animal anesthesia. So veterinary use was very common with ketamine. It's used from time to time now for outpatient anesthesia, probably just due to the fact that narcotics and things have got such a lot of negative press in the last couple of years with the contaminants in the some of the illegal drug trade. So I have used it occasionally for outpatient surgery. Just wanted to mention that before I delve out of here, Jay. Again, I'm not sure whether you mentioned that or not. But that's about all I have for you this morning. And just we'll have to bow out here pretty quickly.
Okay, thank you, Dave. KN2M, and we're all looking forward, the group, to spending time with you and Diane and at Hamvention coming up here in a few weeks. We'll see you in Ohio, 7-3. Thank you for participating in the roundtable discussion today and offering a different perspective on a subject that we really have not spoken about very much. That is an area that we're looking at other uses for, but legally it's available to use in their recognized ways at this time. Thank you. Okay. Mike M4JL, are you back with us, Mike? Okay, Mike is not at this point. Going back to ecstasy and Molly in assisted therapy for PTSD and the phase 3 results, 71.2%, according to the results that were compiled by the AI here, people no longer met the PTSD criterion at the primary endpoint. So that's interesting. Significant improvement in functional impairment, benefits were sustained at 12-month follow-up, according to this. So the FDA status and path forward in August 2024, the complete response letter declined approval. The key concerns were the trial design methodology that resulted in those results we talked about, the data integrity and the risk-benefit profile. So they continue an FDA dialogue, the particular company, Lykos Therapeutics, and again, the executive order of 2026 that President Trump signed could accelerate the review pathway. So MDMA, or ecstasy or Molly, shows strong efficacy for PTSD, but potentially, based upon one study, but faces regulatory hurdles because of the trial methodology and ethical concerns. Ketamine, as Dave just mentioned, FDA-approved drug, but looking at it for other purposes. And MDA receptor agonist, distinct from serotonin psychedelics, which is interesting. And you might want to go ahead and research that one on your own, because it goes into details that are also related to what Dave talked about, traditional versus non-traditional uses, the potential uses in other ways that research needs to be done from. So I suggest that you research ketamine and look at it as a psychedelic medication therapy. So DMT and another the medication, or the one that's vaporized, smoked, or brewed, and I'm not really familiar with that myself, but it's rapid onset, according to the article in the phase 2A trials that occurred in 2025 to 2026 on vaporized DMT, because its effect was within minutes. Total experience of approximately 30 minutes versus hours for psilocybin. And they went into a lot of details about it. It says Imperial College study, the clinical advantage being a short session duration may reduce the burden on therapists and healthcare costs and scalable delivery models. Is anyone more familiar than DMT about DMT that would like to make a comment? I'll pause one and let me know if you'd like to take the mic. This is Whiskey Bravo 5 Delta Grand Rounds Bayonet for ID purposes, transmitting out of Hawthorne, Florida, QTH of AA4FL. Looking for anybody on 20 meters that might have comments about the subject. Make your call. No comments on 20 meters on our Zoom simulcast. Anyone that would like to comment?
Jay, I have a few things I'd like to mention.
I'm going to turn the bike over to WB1FF5. Go ahead.
Yeah, thanks. I know we're getting to the end of the hour, and I don't want to hold people, but I find the subject fascinating. I've been doing reading about it, and there's a couple of people that have written some very good books. Michael Pollan, Pollan, Rick Doblin, Doblin, on the subject. I have a nephew, my brother's son, who has an MD PhD and practices psychiatry. And I've had a chance to chat with him. He takes an interest in these various substances. So it's like a curiosity from an ophthalmologist point of view. I mean, obviously, I don't have any personal experience or professional experience using these drugs, but it just seems like a lot of things in medicine, historically, because of inappropriate use, recreational use, particularly of the psychedelics, they got a bad name. It's kind of like thalidomide was a drug that got for good reason, got a really bad name because of the birth defects. And only more recently have they found that it has some usages in medicine in situations where pregnancies are not involved. But up until people started to open the door again, there are these drugs, we call them drugs or medicines, depending on what you call them, can sometimes bias one's feelings. Medication's a lot easier on people than drug. but that's just the nuance. Anyway, so there's definitely a stigma when we're dealing with mental health issues versus physical health. And of course, historically, indigenous populations have used a number of these products, drugs, medications, herbs, again, whatever we want to call them, for various types of events, and they're not necessarily driving cars or so forth, which can present dangers in unsupervised use. So trial use in controlled environment is very important. Observers to monitor the use, but that's frustrated by the fact that these drugs or medications, or again, they can last for hours. And how do you have an observer get paid for observing over several hours, particularly if insurance is not going to cover it? And we have a dilemma with our NIH and research funding situation. This has been made worse recently. So it's unclear where the funds would come from. We talked about this. I think major depression, PTSD, addictions, alcohol, opioid, all may be potential diagnoses, and there may be others where these treatments could be of benefit. Just to finish up here, microdosing has been thrown out, just as it's been used with the GLP-1 medications. Again, with very little absolute research on it, but it's like if the big dose works, maybe the smaller dose may be safer and more affordable. Just ideas. Controversial things. Big pharma wants to get involved with this, of course, if there's potential profits. And again, it would be ideal to have the NIH or a governmental funding to do this, but that's meeting headwinds currently. The scheduling gets complicated with the executive orders. I think marijuana was just changed to a Schedule 3, which sounds all in good because it puts it in a class where like the benzodiazepines are. But if you talk to the people who work in the medicinal marijuana or cannabis, they'll tell you they don't have access to the U.S. banking system. So just changing the scheduling doesn't necessarily make it easy to do financial transactions. And again, it just gets into all kinds of complicated issues, which I don't have. I just throw it out there for thought, because we may want to talk about this again in another Grand Rounds in the future as more and more comes out about this. So I was confused by this executive order that just came out. I really don't understand, other than saying, yeah, we should take another look at these psychedelics, how it's going to change any practitioner's use. And again, I'm an ophthalmologist, so I'm reading this with interest, not for use. I do find it interesting, David's observations about ketamine, because it's true, ketamine is currently used, and we did use it in the laboratory with animals for sedation and so forth. But the other medications, drugs, not so much. So I'm maybe more confused by the recent executive order than I am clarified. And I don't know if others feel the same way about this. So I'm sorry to take up the extra time, but I just was making notes. And again, Michael Pollan, Pollan, Rick Doblin, interesting books out there for those who want to read into this. So thank you, Jay.
Thank you, Barry, WB1FFI.
Amen.
Hey, Alpha Mike. We're going to just do an ID here on air, then I'm going to turn it over to Chip on 5RTF. This is Whiskey Bravo 5 Delta, Grand Mounds on the air net. We'll be finishing up here in the next 5 to 10 minutes. We appreciate the amateurs are allowing us the clear use of the frequency. We've been using this frequency for net for many years, long before there was POTA. I know we're in the POTA range. And speaking, Barry had mentioned things do change, and we often revisit subject. Next week for Mother's Day, we'll talk about women in amateur radio, something that we've talked about before. We'll expand upon that in honor of the women in our lives, the mothers in our lives. Turn the mic over to Chip and 5RTF. Go ahead, Chip.
Yeah, Barry had a lot of good comments. I think that the reason for the executive order, other than just throwing a bone to some constituents, it does make the research easier. It's very difficult to get a license to do research on a Schedule I drug, but it's much easier to set up a protocol and get a research program going on a Schedule III. So that may be the biggest advantage of that change. A couple of other comments about the research on these drugs. It's very hard to double blind a psychedelic. People know that they're going to have some strange experiences with the real substance, and just blinding it with niacin is just not going to do it. People know whether they've had LSD or not. MDMA is a little bit better since it's not actually psychedelic, but again, people expect certain effects from just reading about it, and if they don't get that, they have a pretty good idea whether they were on it or not. I have had some patients on ketamine. For some of them, they said it worked. The logistics of ketamine just makes it impractical. To get a good effect, you've got to have IV administration 2 or 3 times a week, which is complex and expensive. And then it's only been out for about 3 or 4 years. Nobody really knows what the long-term effects of ketamine are going to be. So do you really want to be in class 1 of the experimentation, not knowing what's going to happen after 10 years on the drug? It's always better to be a late adopter, and I'm willing to wait before I try any of these things. N5RTF.
Okay, thank you, Chip. N5RTF, Whiskey Bravo 5 Delta, AA4 Falcon Mike. We're transmitting out of Hawthorne, Florida here today. And anyone with a general license on our Zoom or higher, we're doing a third-party traffic, allowing transmissions here. So if they all sound alike, overcoming the vagaries of propagation here today, hopefully. If we look at the drugs, there's the profiles and the safety profiles, adverse effects, psilocybin, commonly headache, nausea, transient anxiety, the serious ones, suicidal ideation, so it needs to be monitored. Contraindications, psychotic disorders, and uncontrolled mania. You see why it's important to research this. And I'm sure in popular culture, magic mushrooms have been discussed, and probably in the movies and such, you've probably seen extreme representations of that. MDMA, clenched jaws, nausea, hypothermia, where we have cardiovascular events, serotonin syndrome, cardiac disease, and ALI use or a contraindication. Ketamine was just discussed, dissociation, dizziness, nausea, blood pressure elevation, potential for misuse, the bladder toxicity or chronic would be a serious adverse effect. Contraindications, uncontrolled HTN, active psychosis. DMT, elevated heart rate and blood pressure, nausea, anxiety, limited data. Generally well tolerated, though similar to psilocybin, contraindications, and this is all being established. I mentioned, I think early in one of the articles, I believe there was some monetary aspect to the president's order as well. Details I don't know. We'd have to research that. What about psychedelics versus standard psychiatric treatment? The onset of effect in psychedelics, 1 to 2 days, which is traditional standard psychiatric treatment, 4 to 6 weeks, potentially. At least that's what's being looked at and discussed. And the amount of treatment sessions, 1 to 3 sessions would be the ideal goal for the psychedelic assisted therapies if they can be determined, whereas the standard psychiatric treatment can be daily and definite, depends on the severity of the problem they're trying to solve. The response rates are different. They're supposedly claimed to be a little bit higher in the psychedelic assisted therapies that have been looked at so far with a lower remission rate, although the remission rate's been pretty much equal. The duration of benefits, week to months on the psychedelic assisted single dose, whereas the standard psychiatric treatment claimed here to be require ongoing use. And then difference in the mechanism, the psychedelic assisted being agonism of the serotonin receptors, the neuroplasticity being important. There's the standard therapy of serotonin uptake, reuptake inhibition. The FDA regulatory landscape in 2026. The ketamine's already been approved. Monotherapy for treatment-resistant depression in January 2025. Psilocybin phase 3 complete positive results in February 2026. Priority review voucher April of 2026 to take it to the next level. MDMA, and talking about the mollies and ecstasy. The FDA declined in August of 2024, but they're looking at additional studies planned. DMT phase 2A, positive results. Nature Medicine publication of February 2026. LSD phase 2, general anxiety disorder, ongoing enrollment. Imaging, which we really didn't talk about because it's preclinical right now, in the executive order, prioritize research for addiction and that. So that's something we can certainly talk about more in the future. There's state level policy and legislation. 2020, Oregon and Measure 109, the first state to legalize psilocybin services and licensed facilitators operational since 2023. Colorado, 2022, the Natural Medicine Health Act legalized psilocybin, DMT, imaging, mescaline healing centers, according to AI, opening in 2025. We can't confirm the accuracy and do further research. Utah authorized state-funded psychedelic research centers for veterans with PTSD in April 2026. In 20 plus states have active legislation on decriminalization measures. Massachusetts, California, Connecticut, New York amongst the leaders in research that, but according to AI, 2024 to 2026 states have taken actions in that venue. The executive order we just talked about, the presidential directive, accelerates psychedelic drug development, PTSD, addiction treatment, resistant conditions, directing the FDA to dramatically accelerate review, fast track them for psychedelic therapies for approved indications. The research funding, which prioritizes federal funding for clinical trials on imaging, psilocybin, and MDMA for veterans. DEA schedule of review supports rescheduling reviews already initiated by the DEA from August of 2025 for psilocybin. Veteran focus, emphasize access for military veterans with PTSD and treatment-resistant conditions. And the right to try expansion, considering extending the right to try framework, psychedelic compounds for terminally ill patients. We're looking at the clinical implication framework, screening, medical and psychiatric assessment, culture education checks, and informed consent, their preparation, therapeutic alliance, intention settings, psychoeducation, administration, and how to control the clinical setting, trained therapists that are present, which allow to be monitoring and integration into the traditional therapies, post-session therapies, meaning making, sustained behavior changes over 2 to 6 weeks. Key requirements for practitioners would obviously need to be specialized training in psychedelic assist in therapy protocols when they're generated, and other similar situations that were appropriate. You can look at those slides if you're here on 20 meters, healthcarehams.org, in the post section of the entry page in the right-hand column. So the challenges and ethical considerations that CHECM5RTF, difficult to do blinding studies here because the psychoactive effects make true double blinding studies impossible. Active placebos only partially address that. There's also ethical concerns about therapists' boundaries and vulnerable states. MDMA trials face criticism of boundary violations in some states. Access and equity, the risk of a two-tier system, expensive clinical access versus unregulated use, and insurance coverage remaining of certain scalability, therapy-intensive model of 6 to 8 hour sessions, challenging the healthcare capacity and cost effectiveness, the long-term safety, limit data at this point on repeating dosing requirements, need for longitudinal studies on chronic use patterns and scheduling conflicts, Schedule 1 status and repeated research, the DEA rescheduling review to transform the landscape. What about the future outlook and conclusions as we conclude today's discussions? The psilocybin NDA submission expected 2026, 2027 for potential first FDA-approved psychedelic. The executive order may catalyze accelerated regulatory pathways across multiple compounds, novel delivery modalities, vaporized DMD, microdosing, mentioned Iberi, WB1 FFI, expanding treatment options, growing integration into mainstream psychiatry, CHIP introduction with 5-OTF, looking at major academic settings, centers establish psychedelic programs, the need for standardized training, certification, and treatment protocols across jurisdictions, health, economics, research is essential, cost effectiveness versus chronic or traditional therapy. So we're looking for the convergence of positive clinical data, evolving regulation, political and support positions, psychedelic-assisted therapy as a transformative force in psychiatric medicine. So thank you for everyone here on 20 meters that's allowed us the use of the frequency to have these discussions, these roundtable discussions amongst members of the Grand Rounds on the Air Net and Radio Net, whether it's on 20 meters or participation through a Zoom simulcast. And this should be up as a video on our YouTube channel, Healthcare Hams, 3 separate words, Healthcare Hams. I'm going to pause one here as we stop our